Yes, I can hear you, Hester.
Great. Hi, everyone, and welcome. My name is Hester Paul. I'm the National Director for the EcoHealthy Childcare Program, which is a program located or housed within Children's Environmental Health Network. So I'll be one of the presenters today, and we also have Dr. Laura Anderko, who is the Principal Investigator for the Mid-Atlantic Center for Children's Health and the Environment. Next slide. So the first thing we want to do today is just go over a couple pretest questions for you. So shortly after this slide, we're going to ask you 3 pretest questions. I will read them off to you, but we're hoping that you will just give a quick true or false answer. You will receive those same questions at the end of the webinar, and that helps us best assess how well we're doing in conveying the information that we're trying to relay. Today we will be going over an introduction to children's environmental health, making sure we're all on the same page of what does that actually mean when we talk about environmental health. We'll talk about why kids are specifically vulnerable to toxic exposures or chemicals. We'll also talk about different types of environmental health exposures. Today's focus is going to be on lead near the end, but we will give you kind of a preview of all of the different environmental health hazard topics that we cover within EcoHealthy Childcare, and be sure to share resources with you for where you can find additional free resources. Finally, we are going to share some information about our EcoHealthy Childcare program so that if you would like to be engaged in accessing further information about protecting children from environmental health hazards within early care and learning settings, you'll know where to go. Finally, we are going to highlight specific environmental hazards found within early care and learning environments. When I say that phraseology, just think of childcare, daycare, early care and learning, really any kind of care that's intended for children between the ages of 0 and 6 years. And finally, we will be offering solutions for reducing or omitting completely exposures to chemicals or environmental health hazards. Those terms are also used interchangeably so that we can all work together to create healthier and safer early learning environments. Next slide. Great. So these are the 3 questions that we are going to ask today. The first one is, plumbing fixtures can contain lead. So it is important to use hot water when drinking, cooking, and making baby formula. Please respond yes or no. Next slide. Our second question is, children eat, drink, and breathe more, pound for pound, than adults. Please respond yes or no. Next slide. This is our final question. If your child care facility or your family child care home was built before 1978, you should inspect it for chipping or peeling paint or paint dust. Yes or no? Wonderful. Next slide, please. Here I'm going to hand it over to Dr. Laura Anderko.
Thanks, Kathy. Can you hear me okay?
Yes. Yes.
Thank you. Welcome, everyone. Good afternoon. I am delighted to be partnering with our CHEN members and friends. And today I just wanted to share a couple 2 or 3 slides about the Mid-Atlantic Center for Children's Health and the Environment, as well as the national network, which is called the Pediatric Environmental Health Specialty Unit. We are grateful to the following organizations who has helped funded this webinar, as well as our work in general. It includes the American Academy of Pediatrics, the Agency for Toxic Substances and Disease Registry out of CDC, and the US EPA. I really want to give a special shout out to our champion in Region 3, Prentice Ward, out of the Office of Children's Health, that has helped fund this and make this possible. Next slide, please. Thanks. This is just a copy of our brochure, and I won't go into all the detail, but the Mid-Atlantic Center for Children's Health and the Environment focuses on children's health and reproductive health and how it's impacted by environmental exposures. We offer outreach and education and referral, consultation and referral. The outreach education, particularly as it relates to children and pregnant women, we can offer for your groups if you're interested. Our website is on the lower right-hand corner of the slide. There's lots of materials that we like to share, as well as our toll-free phone number if you want to call with a question. Next slide, please. If you're not from Region 3, which includes that light blue colored on the right, those states, there is a PAYSU near you in your regional area of the country, and paysu.net is the website, and it also has lots of information, lots of other webinars, CEs for nurses and CMEs for doctors. Check it out if you're interested in exploring further information around children's environmental health and reproductive health as it relates to environmental exposures. Next slide, please. This is my final slide, and again, I want to thank those funders for this opportunity, but I also wanted to just touch briefly about our work with consultation, referral, and outreach education, in particular around child care facilities and schools, places of learning. The Mid-Atlantic Center for Children's Health and the Environment has done a lot of work with school nurses and child care workers and others, principals and families, to first of all do an exposure assessment and look at, as that one of those polling questions said, do an assessment for the facility, and to also guide folks if there are environmental exposures that could impact children's health, to help them eliminate it. There are a lot of resources both on our website and EPA's website on how to do that. And I'm so thrilled today because we have the experts in child care settings giving us the lowdown on those settings and how we can not only assess but help to remediate some of those issues. Thank you. Next slide, please.
Great. Kathy, can you hear me?
Yes.
Great. All right. Thank you, Laura. So we're just going to get started here. I first wanted to provide you with a little information on Children's Environmental Health Network, just briefly. Again, EcoHealthy Childcare is a national program of Children's Environmental Health Network. CEHN, our acronym, is a national nonprofit organization based in Washington, D.C. We've been around for over 25 years, and our mission is to protect the developing child, which is actually inclusive of children within the womb, from a healthy environment and from environmental hazards, and to promote a healthy environment. So our work very much looks at the intersection of health and environmental hazards like pesticides, toxic chemicals in consumer products, air pollution, for example. We promote research that looks at preventing known exposures, and we also advocate for sound policies and advocate for policies that place children at the center. So if we think about it, if children are intended to be protected, then we know that there are protections for the rest of us who are older and less vulnerable. EcoHealthy Childcare is a national program. We will talk about that a little bit later in this webinar, but just keep in mind that there is an overarching organization, and then there's a specific program that is intended to support all types of child care professionals in identifying and reducing known exposures within all types of child care facilities. So that would be inclusive of early Head Start and Head Start, center-based care, as well as family child care. Next slide. So just to make sure that we're all on the same page, when we talk about children's environmental health, what we're thinking about is anything external to a child. So children's surroundings, and that could be inclusive of furniture and carpets around them, household chemicals that are being used to clean or sanitize or disinfect, the toys that they're playing with, the items that they're mouthing, such as pacifiers or sippy cups or baby bottles, the food that they're eating, the water or milk that they're drinking, the air that they're breathing, either outside or inside. So really anything external to a child. And we're thinking about whether or not those external features, again, whether it's a simple shelf in a bedroom or whether it's the air coming in through the window, whether or not that might contain chemicals or heavy metals or environmental health hazards that could impact negatively the health and well-being of that child. So if we know where those chemicals or heavy metals are found, then we want to take steps to best protect these vulnerable children, to protect the health and wellness of their bodies for the rest of their life. So we do know from empirically based or scientifically based evidence that we see that there is a very strong link between adverse or negative health effects and the exposure to harmful chemicals where children spend their time living, learning, playing, or praying. Next slide. So we know children are not just little adults. We can't think of them that way. They are distinctly different than us. If we just think of a couple features, first of all, their stature. A young child is, a foot or two off the ground as compared to a typical adult who's 5 or 6 feet tall. If you think about that child and they're standing up, the air quality that they're breathing is actually different than the air quality that an adult would be breathing just a few feet taller. To bring that home, let's think about carpet. So if you have wall-to-wall carpeting, anytime you've ever tracked in with your shoes any kind of dirt, we have little, fragments of that dirt getting stuck into those carpet fibers. Same thing with any kind of cleaning agent or fragrance that you've sprayed within the room. That eventually filters down and gets caught within those carpet fragments. So the air quality, no matter how much you're vacuuming and cleaning, is different for that child just because of all of those residual chemicals or dirt or dust that has compounded within the carpet. So that's just kind of a quick illustration for you to think about why would it be different air quality down where a child is spending time if they're a little bit shorter than us. If they're not even standing yet, then they're sitting on the ground wherever we place them. They're maybe rolling around before they begin to crawl, or maybe they're crawling. So these are all behaviors that are very different than a typical adult would be experiencing. And again, that means that they're spending time in different ways on the ground as compared to an adult. And we also really want to keep in mind, as you all know as child care professionals, that children are very much reliant on adults to make the best decisions possible for them. So we want to keep in mind, where can we make a better decision, and hopefully it's free or low cost, so that we can immediately improve the environmental health where children are spending time. A couple more examples is they have very natural hand-to-mouth behavior. This is all developmentally appropriate. I'm a parent of 3 children. They're now 5, 7, and 9. But when they were younger, you see it all the time, right? They're picking anything up. They're putting it in their mouth. And that's how they're discovering and learning about an object. That's a different behavior than what you would typically see an adult do. But again, they're trying to discover something. Well, if the item they're discovering, let's say it is a rock in the garden and they're licking it, that means they might be containing or consuming dirt that could contain lead in it, for example, or maybe the dirt contains residual pesticides that were sprayed on the lawn. So that's a different type of behavior which will lead to different types of exposures to chemicals. Last thing is, in relation back to one of our questions, children do actually eat more, drink more, and breathe more air per pound of body weight. So if you compare the ratios per pound to pound of a child to an adult as compared to adult. And if you just think of a typical child, every 2 hours they're starving, right? If you leave for a little outing and you don't have snacks within your purse or your bag, that's going to be a party foul and it will become an issue later. So we know that kids are consuming more regularly, which means we really want to think about what are they eating and ingesting. And another area of topic could be food variability. What types of food are they eating? It's usually not as varied as what adults are eating, so we want to be very careful about what we're selecting for them to consume. Next slide. So we know that children are more vulnerable also because their organs are still developing. And so we won't belabor this, knowing that you guys know a lot about child development. But in those early years of 0 to 6, there's extreme development going on. Just looking at how much you may have changed in the last 6 years compared to the changes that occur for a child between birth and the age of 6 or beginning first grade. So there's extreme physical development, mental development, neurological that's changing, and that makes them particularly vulnerable. We know that their metabolism is not as efficient, so they can't actually process chemicals as efficiently as adults do when they have exposure. We know that early chronic exposure, so chronic means it's a continual, very regular exposure, they put them at a greater risk later on. So what we do know from research is it's not just the amount of chemical that a child is exposed to, but it's also the duration. So how long did that happen, and how intense was it? So how long did something happen? For what intensity did it happen, and how old was the child? So there's many factors that we're thinking about when we think about kids and their exposure to environmental health hazards. And then we have to think that they have many years in which to become sick. So as an adult, if you're exposed to something, A, you're not in that extreme phase of development, but B, you only have X amount of years left, whereas a child is just beginning their life, which means their bodies have more time to be susceptible to those chemicals. And we are still studying and learning what are the impacts of chemical exposures from a very young age, and how does that play out in the long run. Next slide. So we also want to think about, and I alluded to this earlier in the presentation, the in utero exposures. So we know that child care professionals are predominantly female, and they're females of childbearing years. So whether or not a provider is pregnant, they may want to become pregnant, they may be becoming pregnant soon, or maybe they already are pregnant and they just don't know it yet. But what we do know is that children can be exposed to chemicals in utero or while in the womb of their mothers. So we want to be very cognizant that these best practices for reducing potential exposures within early care and learning environments are also just very protective for the providers themselves. So in looking at this chart here, it's helping us to understand how vulnerable a child in utero is for these different phases and stages of development. So ultimately, the timing of exposure matters. And if you look at the dark blue graphs, bars, then you'll see that those are indicating highly sensitive periods of fetus development. So the very, very, early stages. And then if you look at the light blue, we see that those are less sensitive, although obviously very sensitive times still for the child in utero. And just going through, the first one is central nervous system, heart, upper limbs, eyes, lower limbs, teeth, palate, external genitalia, and ear. So what it's showing us is sometimes even before mom knows she's pregnant, we know that she needs to be very careful of exposures or potential exposures to different types of chemicals or heavy metals because of the vulnerability of the child in utero. Next slide. So if we just take a step back and say to ourselves, how did we get here that we need to be so concerned about all of these possible chemical or heavy metal exposures? Like how is this how is this possible? So the primary federal law that has regulated the chemicals in our consumer market, when we go to the store, Walmart, Target, what have you, is called the Toxic Substances Control Act, or TSCA is the acronym. I just want to say real quickly, this has been updated in June of 2016, but it's still very much in the implementation phase. So that's why I first want to kind of set the stage and talk to you guys about why are we in this stage where really a lot of the onus to be knowledgeable and careful about what we purchase or eat or consume is very much on the consumer still. So again, TSCA was the primary federal law, still is very much so, regulating the chemicals that are found in all of our consumer products. This law was passed in 1976, and it was implemented in 1979. Today, there's approximately 80,000 chemicals that are in our consumer market. In 1976, when this law was passed, there were already 60,000 existing chemicals. Because we didn't have the funding or the time to individually test each of those 60,000 chemicals, they were grandfathered in and kind of believed to be, all right, we're just going to continue using them unless we find that there is a problem or a negative impact on human health for using them. Since 1976, an additional 23,000 chemicals have been added to the market. So we have a total of about 80,000 chemicals, and they're ubiquitous, meaning they're found in almost everyone. I mean, really in everyone, because we're all having ultimately the same types of exposures in where we spend time, the foods that we consume, and the products that we use. This law authorizes EPA, or the Environmental Protection Agency, to identify and regulate chemicals found in consumer products. But the difficulty here is ultimately the burden of proof of finding out whether or not something is problematic is placed on EPA, which is the public versus a private industry creating the chemicals. Next slide. So the chemical, like I said, was presumed safe unless found otherwise. So again, this put the burden of proof on the Environmental Protection Agency, where EPA would have to submit data showing that there was evidence or potential evidence of harm to negative complications or health concerns for humans. And this is problematic, right? Because there are many chemicals out there. They're being added to the market every day. And ultimately, chemical restrictions or bans were very limited, and only 5 chemicals were actually restricted. So that should be pretty eye-opening right there, just letting you know, that means that the majority of those chemicals are still found on our market and our consumer products where we're being exposed to them routinely, and we don't necessarily know how positive or negative those impacts of having exposure to those chemicals could be. Next slide. Okay, so the law, we said, has been updated. So the good news is it was updated in TSCA in June of 2016. The updated law is called the Frank R. Lautenberg Chemical Safety for the 21st Century Act, so it's kind of a mouthful. The good news is that many people realized that TSCA needed to be updated and worked together to do so. And so the updates include that there is now a safety assessment, which is a health-based. So what are the health-based risks? There's an evaluation done where, okay, let's look at this chemical and find out whether or not there would be a risk to the health and wellness of people should it be used. Secondarily, new chemicals are evaluated or will be evaluated now before introduced into the market. And there are enforceable deadlines for evaluating chemicals. There's also a prioritization of chemicals of high concern, of the ones that persist or are used often or in high amounts. So the good news is that we are seeing, we're seeing that things are being tested and there is a good plan for it, but ultimately we're still very much in the implementation phase of this law. If we think about toxicity testing, there are some challenges. So when we're actually testing chemicals, what are the challenges that are related? Well, for the first thing, testing doesn't account for synergistic effects. So ultimately, what happens when exposed to 2 chemicals at the same time? Well, if you think about it, anything that you're using, just picture maybe the baby lotion that you put on a child, many chemicals are being brought together to create that lotion. And so all the time we're seeing that there are chemicals being placed together, and it's hard to know how are those chemicals interacting or what is the synergistic effect. And if you think about lotion, that's not even talking about like something that has fragrance added to it. So I'm just trying to kind of expand your thinking there. So let's say we just have a regular lotion and we add fragrance to it. Many different chemicals came in just to create that smell or the fragrance, let alone the lotion itself. Also, testing does not account for low exposures or cumulative exposures. So it doesn't account for how long we might be using something or how long we might be exposed to something. Next slide. So how are children exposed? We've gone through this a little bit already, but ultimately through ingestion. So what are they eating? And are those foods cleaned properly? Are they organic? Are they being pulled from a can that may be BPA containing? So bisphenol A is often found on the interior of canned food, and that could relate to chemical exposures. If we think about the example of a young child, let's say that they are formula fed. If their formula is in a powdered form, and let's say it's not in a BPA containing can. So we took care of that problem, but then we're adding water to the powder. Has that water been tested for lead? And if not, could there be lead exposure in the water that you're then adding to the powdered formula? If that's what the child is eating all the time, and if there is lead in the water, then again, that goes back to this complication of food variability. There isn't any variability because that's all they're eating all the time. So we need to be very thoughtful about what is the child consuming, and have we thought about not just the type of food, but also the containers that are being used or the containers that the food is coming in. They also sometimes consume soil, right? Not on purpose necessarily, but if they're outside playing, it's very typical that a child may pick something up, put them in their mouth, and again, you could have a residual of pesticides, or you could have soil that's found, or lead that's found in the soil. We want to think about inhalation. So what are they breathing? We could think about tiny particles of dust that might have lead in them from cracking or peeling lead-based paint. We could think about household chemicals and what you may be spraying around your home, or maybe the PAM spray in the kitchen, and how those chemicals, especially aerosols, will really shoot chemicals out, and they're very microscopic. They stay suspended for a long time in the air, which means they're hanging out there for a long time and children are breathing them in. So I would say right now, just stop buying all aerosols and instead choose something that's a direct spray as an alternate. Finally, we also want to think about skin absorption. So if you're thinking about bug spray or sunscreen or chapstick or lotion, shampoo, conditioner, these are all products containing chemicals that we want to be thoughtful about as they do relay another possible way that children are exposed to chemicals. Finally, we want to think about prenatal exposures, and again, what is mom consuming or what is mom exposed to that might be impacting the health and wellness of the child in utero. Next slide. So ultimately, right, it's a little bit daunting, and we want to think about, okay, we know environmental exposures start in the womb and can have effects throughout life. They're affecting adults too, but we're just mostly concerned about the vulnerability of children. But to give you kind of just the lay of the land, more than 1 in 4 deaths of children under the ages of 5 are attributable to unhealthy environments. Every year, environmental risks such as indoor and outdoor air pollution, secondhand smoke, unsafe water, lack of sanitization, and inadequate hygiene take the lives of about 1.7 million children under the ages of 5. So important determinants of health basically come from the natural environment, the built environment, so sidewalks and parks and buildings, and social environments. So ultimately, everywhere where children are spending time living, learning, and playing. So accessibility to safe housing, healthy nutrition, proper health care, and social supports are all very important. And many of these previously relayed, factors, again, nutrition, healthcare, interact to ultimately create the conditions for overall health and wellness of a child or their potential vulnerability to disease. So it is very mind-boggling. There's so many factors to think about, but that is the case of really picturing all of these different exposures within children's environmental health. Next slide. This you may have seen before. Oh, sorry, go back. Yep, thank you. To the concentric circles. So if you think about it, there are very complex interactions occurring at many variables across individual, community, and societal levels. So ultimately, there are many things that make up the health and wellness of a child. What is the nutrition? What's the food that we're giving them? What's the liquid that they're drinking? How present and caring is the parenting? Do they have access to well visit exams in their different types of health care? Are they socially integrated with other children? Are they going to school? What is their genetic makeup? And ultimately, you see here on the outer circle is the environment, because the environment is inclusive of everything. What's the furniture that they're around? What's the shampoo that mom's using in their hair? So ultimately, rarely is one particular thing responsible for health or disease. So we kind of refer to this as a multifactorial or ecological approach. And the best way to promote health and prevent disease is to kind of look at all factors together and ultimately see where we can impact change or improve the health and wellness of a child. Next slide. So here, this is a meta-analysis looking at concerning trends of the identification of disease and illness between the years of 1975 and 2011. And ultimately, we see that there's strong evidence linking environmental exposures, again, such as lead, pesticides, mercury, unsafe plastics, and poor health outcomes. So we see increased obesity, increased attention deficit hyperactivity disorder diagnoses, increased diabetes, and increased cancers. And if you just note quickly on the left-hand side of the screen with those little vertical white lines, those are just illustrating the compressed arrows, given that these examples span a longer period of time. But what's important here is the idea of a declining threshold of harm. So as scientists' understanding of and ability to measure levels of chemicals improves over time, constitutes a safe level of exposure to these compounds basically tends to fall. So sometimes dramatically. So for example, in thinking about lead, so toxic blood lead levels, a concerning level was formally set at 60 micrograms per deciliter in the 1960s, meaning if someone tested your blood for lead and found that it was at 60 micrograms, you would be deemed eligible and said, okay, I think this is a concerning case. Well, now, in current days, we know that the current Center of Disease Control and Prevention blood lead level of concern is 5 micrograms per deciliter, and it's now widely accepted that actually there's no safe level of lead exposure at all. So if you look at that just from 1960 till now, we went from 60 micrograms to 5 micrograms, and that just shows you that downtrending of realizing how much chemical exposure would be relational to something that's potentially problematic. Next slide. So we know that health disparities also exist, a very important point to make. And just looking at this, we know that often African American and Latino Americans live in more polluted environments and have less access to health care. That's a general statement. It's not always the case. But looking at some of these stats here in 2017, African American women in the United States were the most likely to have a low birth weight infant. In 2013 to 2016, Latino and African American children were more likely to have obesity as compared to their white peers. And in 2017, African American children, 13%, had asthma as compared with 8% of white children, 8% of Latino, and 4% of Asian children. So just making the point here that health disparities exist, and we want to pay attention to that to ultimately support all children regardless of where they're spending time and what their race is. Next slide. So we also want to think about neurodevelopmental and neurobehavioral disorders. So some of these increases is relational to early identification and diagnosis, so better diagnosis from doctors and our medical professionals. But looking at some stats here, 20% in 2016 of children in the United States had been diagnosed with some type of learning or attention issue. Often with these complications, we see that there's a difference in gender. So in looking at learning disabilities, it'd be about 10% of boys and 6% of girls. That was the stat from 2015. In looking at attention deficit hyperactivity disorder, which is a form of learning disability, we also see that there would be more than 14% of all children have some kind of diagnosis within that spectrum. And looking at autism, for example, right now in 2020, the latest statistic from the Center of Disease Control and Prevention was 1 in 54 children have a diagnosis somewhere on that spectrum. Next slide. And looking at asthma, I'm starting to run a little short on time, so I'm going to move a little bit speedier here. But same thing, we're basically seeing that there is an increase in diagnosis. There's also an increase in the number of children that have been found to have some sort of complication of asthma, and that can be related both to indoor and outdoor air quality. Next slide. So in thinking about all of these different possible ways that we're exposed to unhealthy air in outdoor and indoor air, we want to think about many features and factors such as tobacco smoke, mold and dust mites, cleaning products, fragrances, pet dander. So this slide is really illustrating all of the different factors that play a role in the different types of air quality. Next slide. Again, this is looking specifically at childhood cancers. And ultimately, we know that a small amount, 5 to 10%, can be solely attributable to genetic defects. And we know that a large percentage, 75 to 80% of cancer diagnosis and death in the United States is related to different environmental factors. And remember, environmental factors is so broad-reaching, but that would be all-encompassing, for example, of thinking about chemical exposures through products, or maybe thinking about pesticide exposures. Next slide. So is the environment to blame? Ultimately, science tells us that environmental health hazards like air pollution have a role to play in our children's health, and that's why we want to work together to decrease or altogether prevent exposures that we know are problematic. Next slide. So what can we do? We can take steps to work collaboratively to protect children where they're spending time. And we know in the case of early care and learning environments or child care, children are spending upwards and sometimes more than 40 hours a week in some form of child care. So let's pay attention to that location because it's very much as important as the homes that children are being raised in. Next slide. So approximately 12 million children are in child care nationally. And again, they're spending up to 10 hours a day, 5 days a week. Some kids are spending more time in child care depending on the needs of their parents and caregivers. And so let's look now at kind of how well child care is doing. Next slide. So we know that very few environmental health issues are comprehensively addressed by existing early care and learning professional development, quality rating improvement systems that are offered on a state-by-state basis, and licensing regulations. Progress is being made. We're very proud of the work that we've been doing over the years. These are just two of the examples of kind of our behind-the-scenes work. But since 2017, the National Association for the Education of Young Children basically now address environmental health issues within their accreditation standards, and that was work that we did in partnership with them. And another example is looking at the National Resource Center for Health and Safety in Early Care and Education and Child Care. And basically, we have worked with them to, we created the Environmental Health Collection. It's a special collection of standards with them. And we also work with them regularly to review and update their standards to make them more comprehensively protective of children when we think about environmental health considerations. Our ultimate goal would be eventually to support different state child care licensing regulations at adopting more protective standards, but that, as you might imagine, is a long process. Next step. So how did we create this eco-healthy child care program? Ultimately, we identified this information gap where there are many considerations for child care professionals for protecting the overall health and well-being of young children. But what we wanted to do is say, how much information is really being shared with child care professionals around possible chemical exposures or heavy metal exposures? And again, this program is applicable for all types of child care facilities. So our aim is, and always has been, to determine what are free or low-cost strategies that are realistic, and ultimately it's just up to the provider. If they decide to make a change, it's something that they could do immediately and see a positive impact on the health and wellness of children. And our aim is very much to do this in partnership with child care professionals and kind of support you along the way. Next step. So the Eco-Healthy Child Care Program, again, our ultimate goal is to identify and reduce known environmental health hazard exposures within early care and learning environments. We want to protect young children and also those providers who are typically women of childbearing years. And again, we have a plethora of free resources that I'll share later, but ultimately we have a 5-hour Train the Trainer course, an e-learning course that you can take, many free fact sheets, free frequently asked questions. There's an endorsement checklist you can go after. So we encourage you to visit our website and to learn more. Next slide. These are the topics that we consider our core content topics. So today we're going to hone in on lead a little bit, but we have many resources covering all of the topics that you see here. Next slide. We also have additional topics. So if a question comes in that's very specific, such as bug repellent or safer sunscreen use, then we actually, when time allows, will develop resources in response to the questions being asked by providers. So just to let you know that there are many additional topics where we also have resources that are completely free, and many of them are already available in Spanish as well. Next slide. So for each topic, we try to first hone in on what's the health effect of concern? Okay, so why are we concerned about pesticides in the first place? Where is that chemical found? You know, are pesticides being used inside? Are they being used on the lawn? Let's think about this. And we try to provide you with free or low-cost alternative solutions. So it's not just to stress you out and have you be very concerned about something, but it's trying to give you an alternative remedy or an alternative best practice that you can implement. So we're not about just trying to stress you out, but really providing realistic solutions. Next slide. So now let's just talk a little bit about lead hazards and where lead might be found within child care settings. Next slide. So the dangers of lead generally is that lead can be found in all parts of our environment, in the air, the soil, the water, and even inside our child care facilities and homes. Much of our exposure comes from human activities, actually, and that would be examples such as including the use of fossil fuels or the past use of leaded gasoline, some types of industrial facilities, and the past use of lead-based paint. Lead has been used in a wide variety of products found in around our homes and child care facilities. And in addition to paint, different options or examples include ceramics. Those are usually the imported ones or old or handmade, pipes and plumbing materials, solder, gasoline, batteries, ammunition, cosmetics, children's toys. I mean, the list goes on. But the good news is we know that exposure is preventable. And so one of our recent projects just released in October of last year is a whole comprehensive lead-safe toolkit. The toolkit is right now in its form intended for home-based childcare or family childcare, but it's in our intention for this next year to also rework some of those materials and make them applicable to center-based care. And I would say right now, if you're a center-based childcare professional, to just look at those materials anyway. So what are the dangers of lead? Let's just think about, like, why does it matter? Ultimately, children are exposed to lead or could be exposed to lead on a routine basis, and ultimately we have the role of a child care provider or a parent to protect those exposures when possible. So we know babies and young children absorb more lead than in adults, just thinking about their developmental phase. Their brains and nervous systems are more sensitive to the damaging effects. And the amount of dust that it takes to harm a child is actually invisible to the naked eye. And this is where this is a good illustration for you. So if you imagine a standard sugar packet that you might use to sweeten a cup of tea or coffee, and now imagine that instead of sugar, it's filled with lead-contaminated dust. This is equivalent to about 1 gram of dust. Now imagine that the 1 gram of dust is spread evenly over about half of the area of a football field. That's enough for the Environmental Protection Agency to consider it a contaminated surface. And that means that the amount of lead-contaminated dust that it takes to harm a child is invisible to the naked eye. So that's important because ultimately, I think when we say dust, people often think of like a big dust bunny. But what we know is these exposures can be just completely naked to the human eye. Next slide. So what happens? Like, how does this exposure happen? We've gone through a little bit of this already earlier in the presentation, but kids put their hands or objects in their mouth. They could be contaminated with lead. They drink formula that could be made with contaminated water. Same thing as the food, or the food could contain lead. They could be inhaling dust that has lead in it from lead-based paint. Or they could be handling toys that, again, has residual amounts of lead from cracking and peeling dust from paint in the home. So these are all different ways. Next slide. Ultimately, too, we know that children are higher risk for behavioral problems. If you have a lot of exposure to lead, we can see a decrease in a child's IQ. We could see impaired memory, and also impaired or negatively affected executive function. Executive function is kind of the ability to plan or remember instructions or juggle multiple tasks at a time. And unless exposed to very high levels, children who are exposed won't appear sick. And so that's important to remember, that really the only way to tell if a child has been exposed to lead is to have a blood lead test. So that's important. You can't just tell by looking at a child, but you actually need to have that child's blood tested. Next slide. So the good news is we know that lead exposure is preventable. We know how to find sources of lead in child care facilities or environments, and we know how to fix them. And ultimately, you all can start taking steps today to make sure that your environments are safe, and to make sure that we have tested for and assessed whether or not lead exposures might be present. Next slide. So the first thing that we'd like to recommend is the encouragement to have children have their blood tested for lead. And here we provide you with a resource to the CDC, or the Center of Disease Control and Prevention. Another option is to contact your local health care provider for more information, so you can learn more specifically about childhood lead poisoning. So we have resources for you. You can look at the EPA website or CDC website, but it's also an option just to think about supporting parents in reaching out to their local healthcare provider and asking more questions and asking for a blood test, which is what we've done with our own children. It's not a big deal. It's just an easy prick, and then you get a result. Next slide. So what can you do when you're thinking about potentially lead-based paint? So the first thing is you can maintain paint, right? Make sure that it's not cracking or peeling. You want to clean floors and window frames and window sills regularly. The reason why we focus on window frames and door frames is because that's where you see the most amount of movement in the framing or construction of a building. If you think about it, if you're opening and closing a window or a door, that's where you're going to see friction and movement, and that's where you would see the initial cracking and peeling in paint usually. We want to wash toys and bottles and pacifiers with soap and water weekly to make sure that we're getting, well, you need to do it more frequently than that anyway for sanitizing and disinfecting regulations, but ultimately you want to make sure that they are free of any type of possible lead dust exposure. Another option is to go free inside. This is a great option if you have an infant toddler room, or minimally, I would say, to lay out a rough mat at the entrance of all doors so that people can wipe their feet and hopefully not track in dirt or dust. Next slide. If you have your home or your child care and it was built before 1978, you do want to have it inspected for lead-based paint. The importance here is to really make sure that you are hiring a certified lead inspector or risk assessor to conduct the lead-based paint inspection. And the EPA has a wonderful tool that we'd like to point to help you hone in on finding a certified lead inspector. Next slide. So here we have a remediation plan. Again, all of these resources and all of this information is going to be offered in that lead toolkit, where we provided a few slides back the link for that. And I'll do it again upcoming as well. But ultimately, there are various things that you can do. So different types of remediation plan, for example, one option would be an interim control. An interim control, for example, are measures such as dust removal or paint stabilization, where they're trying to control the friction and abrasion points. Other examples are full abatement, and that means when you're permanently removing lead-based paint. And again, for that, you want to make sure that you're hiring a certified professional. So again, all of this information is offered in our toolkit. Next slide. So this is the Environmental Protection Agency Renovate Right Guide, and federal law, so it's mandated, requires that contractors that disturb paint or surfaces in homes, child care facilities, and schools built before 1978 actually have to be certified and follow specific work practices to prevent lead contamination. And you can just imagine if you're starting to pull down a building that has lead-contaminated paint or try to remove lead-based paint, you can imagine just like all the dust that would be released, and you want to be very careful of potential exposures, not just for children, but for also adults. So you always want to ask to see your contractor's certification. And again, the Renovate Right Guide is going to offer all the information about legal requirements. Next slide. So here we get into a little bit of what we can do for water. So one easy thing is from this point forward for yourselves, even if it's not with a child, you always want to use cold water from the faucet for drinking, cooking, and making baby formula. The reason for that is that cold water leaches lead much less from lead-based pipes or plumbing fixtures than hot water. So if you just think about if you're pulling hot water from a faucet, it is warming to the degree that it can activate the ions in the metal and release lead from those fixtures or those pipes, and it enters into the water, and then you're consuming it. So you really just want to use cold water always and then heat it up. We also encourage the use of filters for water. And then there are, again, the best thing to do would be just to test your water and find out whether or not there is, in fact, lead. So for all of these different topics of lead and exposure pathways, there will be various levels of how you can react to them. Do you just want to test something right away? Do you want to purchase a filter? Do you want to have a certified contractor come? So all types of levels or interim supports are discussed in the toolkit. Next slide. So first, for water, what you want to do is find out the source of your water and whether it's public or private. So that's going to be something that's very key. And also what you want to do is try to determine whether your home has a lead service line or a lead-containing pipes, fixtures, or solder. And also, again, in our toolkit, there is content that's specific to lead and water. There's a specific policy and a worksheet that I'm going to tell you guys about, and this will go through all the details of trying to assess whether or not you have lead service lines and what to look at and what resources might help you. Next slide. Other areas of lead in child care facilities or homes is thinking about consumer products. So you want to avoid imported, old, or handmade pottery for food. Many artists will actually opt to use lead-based paint when they're painting items such as pottery, and that's because sometimes the colors are brighter, sometimes the application is a little bit better, but ultimately that's not what we want to be eating off of. So maybe you want to just use it for decoration, out of sight, and out of handling care of children. You want to avoid low-quality metal jewelry for children. Many of these are often found to have heavy metals in them, so not just lead, but another example would be like cadmium. We offer this website of healthystuff.org. That's a great resource for you to suss out whether or not different consumer products have been found to contain lead or other heavy metals. And another topic is just thinking about artificial turf. So what are the fields that children are playing on, and is it made of artificial turf? And if so, do we need to be concerned about that because there could be lead within those little pieces of plastic grass or within the filler that's used for artificial turf. Next slide. So in the beginning of the webinar, we talked about different features or resources of the Eco-Healthy Child Care Program. One thing that we have is our checklist that you see here on the left-hand side of your screen. And there are 30 items on this checklist. If a provider or a facility can comply with 24 of 30 best practices, then Children's Environmental Health Network will endorse you for 2 years. So it's a way for us to acknowledge that you're going above and beyond what's required by your state licensing regulations or your quality rating improvement program, so you can really tout to parents. It's a great marketing feature, actually, what you're doing above and beyond to protect kids from possible chemical exposures. And next slide, all of these checklist items are specific to lead, given that we just covered that in this content area today in this webinar. Next slide. So again, all of these pertain to lead. Next slide. Here is the website that you can refer to access our Lead Safe Toolkit. It's all completely free, and we actually have 4 different webinars. The next one that's featuring more information about lead is going to be offered on June 17th at 8 p.m. Eastern Time, and they're just a half-hour in duration. Next slide. These are the 4 main categories that we kind of talked about today, but you can go in and find a plethora of information around lead in paint, lead in drinking water, lead in soil, and lead in consumer products. Each of these topics has a corresponding policy and then also a worksheet where it walks you through very specifically each thing that you can do. Next step. This is the endorsement. I already talked about it with you guys. You can either print off a PDF or you can actually fill it out online and submit it. It's $25 for facilities that are caring for 25 children or less, and then, 20 children or less, and then it's $50 for facilities that have 20 or more children. And you do have to sign that you understand you could be chosen for an external site assessment, in which case one of our staffers visits your facility. It's very much a partnership, and we go through your child care facility and help you support we support you in trying to assess whether or not there's anything that could be done to better protect children's environmental health. Next slide. We also have an e-learning course that has been approved for adult learning clock hours in 48 states. We encourage you to use it. We're actually updating it right now from Adobe Flash to HTML5 so that it's more accessible on all computers. It will be offered, it is right now offered through Pro Solutions, but it will also be offered through Emory in late summer of this year. And actually an opportunity that's being offered by the Mid-Atlantic Center for Children's Health and the Environment, the entity helping to host this webinar, is that there will be 100 free usages for child care professionals who are interested in taking that course to better understand possible exposure to environmental health hazards and what we can do to reduce those exposures. So after this webinar, you'll be receiving a few emails, and in one of those emails, you'll be asked if you're interested in taking this course, you can provide us with your email address, and we will send you the code and the link when the time is right. Next slide. We're going to quickly go through these post-test questions, and the first one is, children eat, drink, and breathe more pound for pound than adults. Is that yes or no? Next slide. If your child care facility home was built before 1978, you should inspect it for chipping or peeling paint or paint dust. Yes or no? Next slide. Last one, plumbing fixtures can contain lead, so it is important to use hot water when drinking, cooking, and making baby formula. It is important to use hot water. Yes or no? Next slide. All right, so thank you very much. I've ended right on the hour, which means if you did provide us with questions, we will get back to you with answers. This is the contact information for both myself and Kathy Attar, who's our engagement manager at the EcoHealthy Child Care Program. Please email us with questions. And otherwise, you have all the links here if you'd like to engage with us on Facebook, Instagram. I would encourage you to sign up for our Eco Hot Tips. They are emails that come out once a month. We follow research and distill it down and make it most applicable to you so that it's helpful within your early care and learning environment. And with that, Kathy, I'll hand it over to you or Laura, but thank you for your time.
Thank you, Hester. I think I'm going to end the recording, and I'd just like everyone to thank everyone for joining us this afternoon.